So you're going to have breast reconstruction with a DIEP flap and want to know the ins and outs of the surgery. What does recovery look like? Where will my abdominal scars be located? How big will my breasts be? These are common questions that I am asked by patients who are going to have breast reconstruction with a DIEP flap. In today's video, we will review these questions and more. Hi, I'm Ramon Garza. I'm a board-certified plastic surgeon who specializes in complex breast reconstruction and aesthetic surgery of the breast and body. I make educational content related to plastic surgery. Firstly, let's go over exactly what a DIEP flap is. A DIEP flap is a breast reconstruction where the breast is recreated using tissue from your abdomen. We take the skin and fat, which would normally be removed in a tummy tuck, and preserve it to recreate a breast mound that looks something like this. This procedure can be done for patients who have breast cancer or are having breast removal surgery for prophylactic reasons. It's a procedure that I perform routinely, and I have performed hundreds of these procedures over the past 9 years. For my patients, recovery from this procedure involves a 2-night hospital stay. After you're discharged from the hospital, you should feel comfortable doing all of your daily activities. Whether it's showering, getting in and out of bed, or any light activity, you'll be fine. During the first few weeks after surgery, you'll feel sore, but the pain should be controlled. That being said, we use a specific pain management protocol that reduces discomfort after surgery. And if this topic interests you, stay tuned because we plan on doing a future video covering this topic. Now, what do the scars look like? And where will the scars be located on the abdomen? These are also common questions that I get asked. For the abdominal scars, we try to keep the incisions as low as possible. How can we create this incision? Some of this is dependent on your anatomy, specifically related to two things: where the blood vessels are relative to your belly button and the amount of lower tissue you have on your abdomen. Taking these factors into consideration will dictate how low we can create your scar. We always have two aesthetic goals with DIEP flap breast reconstruction. Number 1, to create an aesthetic breast mound. And 2, to create an aesthetic abdominal shape. The goal is to give you a result that looks like a mommy makeover. We do this by paying attention to the details. This means things like incorporating a lift at the breast reconstruction site and keeping the abdominal scar low while also giving you a natural appearing belly button. How large will my breast be? When I first meet with a patient, one of the first questions I ask is, what is their goal for a cup size? Based on this information, I can determine if we will be able to reach this goal based on their body habitus. If I have a thin patient with not very much abdominal donor site tissue, but they want a smaller breast mound and are starting off with a small breast, we can still create a very nice breast shape that will be in tune with the patient's goals. For patients who want a larger cup size and they don't have very much abdominal tissue, maybe the DIEP flap isn't the best option for reaching their aesthetic goals. In this situation, they may be served with an alternative reconstruction method, such as breast implants, or maybe a hybrid type of breast reconstruction. For these patients, I want to make sure they have a good understanding of the limitations of each option. Now for a bonus tip regarding your DIEP flap breast reconstruction. Make sure to ask your plastic surgeon if they will use mesh at your abdominal fascial closure site. If they routinely use mesh, that can mean they take larger portions of your fascia overlying your muscle. In my opinion, this can weaken your abdominal wall further and lead to a higher risk of infection or hernia. Now, I do not routinely use mesh in my surgeries as I do not take large portions of fascia with my DIEP flaps. In fact, I can't remember the last time I used mesh in a DIEP flap breast reconstruction. Knowledge is your friend, and don't be afraid to ask these questions to your reconstructive surgeon. Be your own advocate. If you like this video, make sure to hit like and subscribe to our channel. To learn more about this procedure or any other procedures that we perform, check out our website, drgarzaplasticsurgery.com. Also, give us a follow on Instagram. We put lots of educational content on there, as well as before and after photos. Thanks for watching, and we appreciate you coming by.